Assalamu alaikum dear students. Our next topic is scalp. Today's learning objectives are: we will name the layers of the scalp, describe the muscles of the scalp, and we will name the neurovascular supply of the scalp, and will describe the lymphatic drainage of the scalp. What is scalp? Scalp is the term applied to the soft tissues covering the vault of the skull. The soft tissues covering the vault of the skull are called scalp. Extent. What is the extent of the scalp? It extends anteriorly up to the eyebrows. That is the superciliary arches. Up to the superciliary arches. And posteriorly it extends up to the superior nuchal lines, and laterally it extends up to the superior temporal line. Some people believe that laterally it extends up to the zygomatic arch, but mostly it is up to the superior temporal line. So this is the extent of the scalp. Now we will discuss the layers of the scalp. The word scalp has 5 alphabets, so it has 5 layers. The outermost is skin, then the connective tissue layer, then the epineurotic layer, then the loose areolar tissue, and then the pericranium. So these are the 5 layers of the scalp. First we will discuss the skin. The skin of the scalp is thin and hairy except over the forehead. Over the forehead there are no hairs. It is firmly adherent to the epicranial epineurosis by the dense connective tissue layer of the superficial fascia, as in palms and soles. Being hairy, it contains maximum number of hair follicles and is associated with sebaceous gland. As a result, scalp is the commonest site of sebaceous cyst. Sebaceous cysts commonly form in the scalp. It also contains numerous sweat glands. Coming to the connective tissue layer, that is the superficial fascia. The superficial fascia of the scalp is made up of dense fibrous connective tissue that firmly binds the skin to the underlying epineurotic layer. That is the epineurosis of the occipitofrontalis muscle. The fibrous septa divide this layer into various small pockets containing fat lobules. The blood vessels and nerves of the scalp lie in this layer. They enter it from below at the periphery. The walls of the vessels are adherent to the fibrous network. And when the blood vessels are torn or cut during an injury, they are unable to retract and cause profuse bleeding. As we say, the walls of the vessels are adherent to the fibrous tissue, so the walls cannot retract and there is profuse bleeding after injury of the scalp. However, this bleeding can be stopped by applying the pressure. Now coming to the third layer, that is the epineurotic layer. This is formed by the occipitofrontalis muscle. Occipitofrontalis muscle has two bellies. One is the frontal belly and other is the occipital belly. The frontal belly is called frontalis muscle. The occipital belly is called occipitalis muscle. In between there is epineurosis. Since the greater part of this layer is made up of the epineurosis, so it is called epineurotic layer. This layer is also called the epicranial epineurosis or Galea epineurotica. Next is the loose areolar tissue. As the name indicates, this layer is made up of loose areolar tissue. This layer has emissary veins which connect the scalp to the intracranial dural sinuses. Then come the next layer, that is called the pericranium. This is the fifth layer of the scalp, formed by the periosteum of the bone. This is the periosteum of the bone, forming the periosteum of the bone of the skull vault, is called the fifth layer. It is called the fifth layer. It is loosely attached to the bones and can be easily stripped off. It can be easily stripped off, but it is firmly attached to the sutures. Where there is suture, it is firmly attached to it by the sutural membrane. It is firmly attached by the sutural membrane to the which attaches it to the endocranium, which attaches to the endocranium. So these are the 5 layers of the scalp. We have discussed the skin, the connective tissue layer, the epineuritic layer, the loose areolar tissue layer, and the pericranium. And the scalp word also have this spelling. Now we will discuss the muscle of the scalp, the occipitofrontalis muscle. It has frontal bellies and occipital bellies. The frontal bellies, these are the frontal bellies, these are the occipital bellies. The frontal bellies arise from the skin and subcutaneous tissues above the eyebrows and root of the nose. They run backward to be inserted into the epicranial epineurosis in front of the coronal suture. Here, in front of the coronal suture, they are inserted into the epicranial epineurosis. They have no bony attachments. The deeper fibers of the occipitofrontalis muscle merge with procerus, the corrugator supercilii, and the orbicularis oculi muscle. The frontal bellies, these two frontal bellies are longer and wider and partly united in the midline. Partly united in the midline. While the occipital bellies, these arise from the lateral 2/3 of the superior nuchal lines. Lateral 2/3 of the superior nuchal lines, and extend upward to be inserted into the epicranial epineurosis. The two occipital bellies are small and are separated from each other by a considerable gap, and this gap is filled by epicranial epineurosis. Now let us discuss the nerve supply of the occipitofrontalis. The occipital part, this one, is supplied by the posterior auricular branch of the facial nerve, whereas the frontal belly is supplied by the temporal branch of the facial nerve. So it is supplied by the facial nerve. Actions: alternate contraction of the frontal and occipital bellies move the scalp forward and backward over the vault of the skull. When it's acting from the above, the contraction of the frontal bellies raise the eyebrows as occurs in surprise. When it contracts from above like this, it raises the eyebrows like that as occurs in the surprise. And if it is acting from below like this, it is going downward, acting from below. The contraction of the frontal bellies will produce transverse wrinkles on the forehead. When it is acting from the below, the contraction of this frontal belly will produce transverse wrinkles in the forehead, as occurs in fright. When someone is frightened, transverse wrinkles appear here. So this was about the muscle of the scalp, the occipitofrontalis muscle. Now we will discuss the arterial supply of the scalp. This is scalp from above. On either side of the midline, the scalp is supplied by the 5 arteries. 1, 2, 3, 4, 5. By the 5 arteries on either side of the midline. The scalp is supplied by the 5 arteries. 3 in front of the auricle and 2 behind the auricle. Let us see them. This is the supratrochlear artery. Supratrochlear artery is a branch of the ophthalmic artery from the internal carotid artery. And this is the supraorbital artery. Supraorbital artery is a branch of the ophthalmic artery from the internal carotid artery. And then come the superficial temporal artery. Superficial temporal artery is a branch of the external carotid artery. Now at the back, this is the from behind the ear. This is the posterior auricular artery. Posterior auricular artery is a branch of external carotid artery. And this is the occipital artery. Occipital artery is also a branch of the external carotid artery, and there is a rich anastomosis between these arteries. So this was about the arterial supply of the scalp. Now we will discuss about the venous drainage, the veins draining the scalp. So there are 3 veins in front of the auricles and 2 behind the auricle, 5 veins on either side of the midline. This one is the supratrochlear vein, this is the supraorbital vein, and this is the superficial temporal vein. These are the 3 veins in front of the auricle, and the behind the auricle is the posterior auricular vein, this one, and the occipital vein. These 2 veins behind the auricle. The veins of the scalp communicate with the intracranial dural venous sinuses through emissary veins. What are emissary veins? The veins connecting the veins outside the cranium with that intracranial dural venous sinuses by passing through the foramina in the cranium are called emissary veins. Those veins which connect the veins outside with the intracranial dural venous sinuses by passing through the cranium is called the emissary veins. These are emissary veins. On each side of the midline in the region of the scalp, one side and the other side, on each side of the midline in the region of the scalp, 2 sets of emissary veins are encountered. One is the parietal emissary vein, which passes through the parietal foramen and communicates with the superior sagittal sinus. And the other set is the mastoid emissary veins. The mastoid emissary veins which pass through the mastoid foramen and communicate with the sigmoid sinus. So that was about the venous drainage and emissary veins. As far as the lymphatic drainage is concerned, lymph from the interior part of the scalp except the lower half of the forehead, drains into the preauricular or the superficial parotid lymph nodes situated on the surface of the parotid gland. The lymphatic from the posterior part of the scalp drain into the posterior auricular or mastoid and occipital lymph nodes. Posterior auricular lymph node and occipital lymph nodes. So this is the lymphatic drainage of the scalp. The lymphatics from the anterior half of the scalp, except the lower part of the forehead, drain into the preauricular, which are also called superficial temporal lymph nodes, which are situated on the surface of the parotid gland. And lymphatic from the posterior part of the scalp, they drain into the posterior auricular, which are also called mastoid lymph nodes, and the occipital lymph nodes. So this is the lymphatic drainage of the scalp. Now we will discuss the nerve supply of the scalp. This is the scalp seen from above. This is the nose. These are the ears, auricles, and this is the occipitofrontalis muscle, and this is its epineurosis. The scalp has both sensory supply and motor supply. First we will discuss the motor supply. The scalp on each side of the midline is supplied by the two motor nerves. One motor nerve in front of the ear and the other motor nerve behind the ear. Both of these are branches of the facial nerve. The nerve in front of the ear is the temporal branch of the facial nerve. It supplies the frontal belly of the occipitofrontalis. The nerve behind the ear is the posterior auricular branch of the facial nerve. It supplies the occipital belly of the occipitofrontalis. Now we will discuss the sensory supply of the scalp. The scalp on either side of the midline is supplied by 8 sensory nerves, 4 in front of the auricle and 4 behind the auricle. The nerves in front of the auricle are derived from the trigeminal nerve, whereas the nerves behind the auricle are derived from the second and third cervical nerve. So 8 on either side of the midline, 8 here and 8 here. This is the supratrochlear nerve. Supratrochlear nerve is a branch of the frontal nerve from the ophthalmic division of the trigeminal nerve. This is the supraorbital nerve. Supraorbital nerve is a branch of the frontal nerve from the ophthalmic division of the trigeminal nerve. This is the zygomatico-temporal nerve. Zygomatico-temporal nerve is a branch of the zygomatic nerve from the maxillary division of the trigeminal nerve. This is the auriculotemporal nerve. Auriculotemporal nerve is a branch of the mandibular division of the trigeminal nerve. So these are the 4 branches in front of the auricle. Now we will discuss the 4 branches behind the auricle. This is the great auricular nerve. The great auricular nerve is derived from the ventral rami of second and third cervical nerve. Then come the lesser occipital nerve. The lesser occipital nerve is derived from the ventral ramus of the second cervical nerve. Then come the greater occipital nerve. So the greater occipital nerve is derived from the dorsal ramus of the second cervical nerve. And then come the third occipital nerve. The third occipital nerve is derived from the dorsal ramus of the third cervical nerve. So these are the 4 sensory nerves supplying the area behind the auricles. So 4 in front of the auricle sensory nerves and 4 behind the auricles. In front of the auricle, this is the supratrochlear nerve, this is the supraorbital nerve, this is the zygomatico-temporal nerve, and this is the auriculotemporal nerve. This is the great after occipital nerve, this is the third occipital nerve, and this is the lesser occipital nerve, and this is the great auricular nerve. So this is the nerve sensory supply of the scalp.